Surgical instruments, the introduction, the basic concepts, basic types, along with the parts of those basic types of surgical instruments. We will start with the introduction of those surgical instruments. First of all, these instruments are classified depending upon their use in any operation. There are 5 major types according to their uses. Number 1, cutting and dissecting instruments. Number 2, grasping and holding instruments. Number 3, hemostatic instruments. Number 4, retractors. Number 5, tissue unifying instruments. Now, these are the 5 basic instruments types that we will discuss one by one. Cutting and dissecting instruments, which are scalpels, scissors, saws, and the latest method, diathermy. Grasping and holding instruments, which are used to hold the organs, preserve them during the operation. These include forceps and clamps. The forceps could be traumatic forceps or atraumatic forceps. Traumatic forceps are tissue crushing forceps. They completely crush the lumen. And the atraumatic forceps are tissue preserving forceps. They are different. They have space in them. They preserve their lumen. They preserve them. They treat delicately. They are atraumatic forceps. Now we will discuss the hemostatic instruments. Hemostatic instruments are used to clamp the arteries, completely crush their lumen. They are different from those atraumatic forceps. They are artery forceps, which are also known as clamps. They also include cautery. Now we will discuss the retractors, like elevators. When we incise a cavity, we need something to hold its doors in space so that we can do surgery inside the cavity. We use elevators for this purpose. Now we will discuss tissue unifying instruments, which are used to unify the parts that we have incised during the operation. They also include the things that have been unifying those instruments, unifying those parts, unifying operations. These include needle holders, needles, sutures, staplers, and staples that help them in stapling. So they are also unifying instrument. These are all the 5 basic types of instruments used in any operation. Now we will discuss one by one each type. First, this is the forcep. This forcep is a thumb forcep. We use thumb to hold it. It has a hinge, shank, jaw. This long part that helps us in grasping is the shank. This helps us in grasping, applying power. This is the hinge joint. This is the jaw. These are the tips of the forceps. Now, shank helps us in grasping. It also has designs that help us in holding it more precisely. Here it is a serrated design, as you can see. This is a needle holder. These are the parts of the needle holder. First, this is the ring. This is known as finger ring, thumb ring. Apply fingers to it. This is the ratchet joint. It is a separable joint. Yes, it is separable. Ratchet joint. Now we will discuss it. As you can already see, there are many teeth along both layers of this joint. These teeth interlock with each other through the grooves which join with them. There are 3 levels of joining them. As you can see here, 1, 2, and 3. These 3 levels have different functions. The first level is a tissue preserving. Second level compresses the organ. Third level crushes them. These are this is the shank, as we have already discussed. This is the box joint. This is the jaw and the tips. Tips could have teeth or they don't have teeth. Here we don't have teeth. It helps us in preserving the organ. This is the box joint, in which one layer goes inside the other layer. The other layer has space inside them, which allows one layer to go inside it. As you can see, it is going inside. It is a box joint. It is different from scissor, which has no inside space. They both have their own layers, and this is the sliding joint of scissor. Now, in needle holder, this is the forcep. You can see the jaws have designs. Here it is serrated, which helps us in holding the organ. It doesn't have teeth. If it had teeth, it will help us in pulling the tough organs, tough fascia. But this one doesn't have, so it is a tissue preserving forcep, atraumatic forcep. Now we will discuss the serrations that you have seen inside the jaw. This could be longitudinal, transverse, crisscross serrations, or there could be angulated serrations. First three are most common. This one is also seen. Thank you. The end.